Hey, I'm Edgar Luna, dentist in Birmingham, Alabama. On my previous video, I talked about the three areas that are key and most important in dentistry. We talked about the gums and how they're the foundation to everything, your bite and how a stable bite is key to long-term health and hold on to your teeth. And last but not least, teeth themselves and in particular silver fillings. So now what I want to do is talk a little bit more detail about these three areas and how to take care of things so that you can maintain your oral health for the remainder of your life. First, let's talk about the gums. Okay, gum disease affects about 3 out of every 4 adults at this point in time. So it's going to affect almost everybody in their lifetime. Problems with gum disease is it's associated with higher risks of strokes, heart attacks, lung infections, uncontrolled diabetes, preterm, low birth weight infants, even higher risks of cancers. So it's a very bad disease that doesn't get a whole lot of attention that we need to focus on and take care of. What are the ways of doing that? Well, the first thing and most important thing obviously is to see your dentist on a regular basis. If you got perfect oral health, usually twice a year is all you need to do is see them. If you have gum disease, you're probably going to see your dentist on a more basis per year, probably every 3 months. You may need something called deep cleanings to get to that initial healthy state first. But once you get there, what do we do to maintain your health? Well, obviously brushing your teeth is key. We want to brush our teeth at least twice a day. One thing that I find that happens a lot with our patients, as adults, we get up in the morning, we brush our teeth first thing because we have bad breath. We go take a shower, get ready for work and everything else, or school, whatever it may be, and as we're heading to work, we have some coffee or have some breakfast. Well, from the time we brushed our teeth to the time we had that first coffee or something to eat, our teeth were maybe clean for 1 hour. Then everybody goes to work, they come home, they get tired, go to bed, do the same thing over again. Well, the problem with that is in a 24-hour period of time, your teeth were clean for at the most 1 hour in a day. So literally, your teeth are never clean. If I can get you to brush that same time in the morning, but then also brush your teeth right before you go to bed and you sleep for 7 hours, we've gone from 1 hour of clean teeth now to 8 hours of total time clean teeth. You've basically gone from your teeth are never clean to your teeth are clean 1/3 of an entire day. That's a huge difference. So if I had you only brushing 1 time per day, which I don't recommend, but if you had to brush only 1 time per day, I would tell you you have to brush before you go to bed. That's when your teeth are going to get the most benefit from the brushing. Your teeth will stay clean for 7 or 8 hours. That's 1/3 of an entire day right there. Also, when it comes to keeping good gums healthy, flossing is key because you're going to get in between the teeth, which brushing does not do. If I can get you to floss that 1 time right before you brush at night, that will be instrumental in keeping your teeth for the rest of your life. So if I can get you to brush that 1 time, or floss that 1 time, excuse me, and then brush your teeth before you go to bed, you're going to be in fantastic shape. I get questions on mouth rinses all the time too. I think a mouth rinse is fine. A lot of them now do not have any alcohol in them, which is better. Listerine has always been one of the best over-the-counter products. If you did that once or twice a day, I think that's fine. I would not use it over 2 times a day. You could get to a point where you're abusing it. So from a gum standpoint, to keep them healthy, again, if we brush in the morning, but then definitely brush every single night before you go to bed and floss before you do that, that's going to be the key to keeping good, healthy gums. The other area that we looked at past the gums was your bite, and talked about keeping a good, stable bite and how it's going to keep your teeth for the rest of your life. Well, if you're missing teeth, you're going to put pressure on the remaining teeth that they're not supposed to receive. Originally, we had 32 teeth, and we put pressure on all those teeth. Once you start losing teeth, say you had only 28 teeth or even 20 teeth left, they're receiving a lot more force now than when you had 32 teeth. So the more force that's put on them, the more chances they are going to be broken or pushed out of the way and eventually just knocked right out of your jaw. So having all your teeth or replacing any missing teeth is key to putting pressure on your teeth in a uniform, stable way so that you won't put pressure on them in ways that will knock them out of your jaw. So replace any missing tooth you can. I do think that it's better if you can replace it with something solid like a bridge or implant before partials. But even if you have to go to removable teeth or plastic teeth, it's still better than missing any teeth at all. The last area that we talk about was the teeth themselves, and in particular silver fillings. Silver fillings are notorious for a lot of problems and a lot of controversy in dentistry right now. There's three main areas that I talk about silver fillings, why I don't like them. The first is the fact that 50% of the filling is mercury. Mercury is a known poison. It is leaking out of the filling. It is increasing the amount of mercury in your blood system. So why would we want to keep a poison product in our mouth? Obviously no reason. Now, can I really discuss the problems that it's causing? I really can't. I can tell you that we've removed a lot of silver fillings from patients, and we have seen a lot of interesting improvements in the health, but that will always be a controversy and debated by all dentists. But there's two other areas of silver fillings that no dentist can truly argue about. The first is the fact that silver fillings break teeth. It's a metal product. When you put heat on it, it expands and it puts pressure on your remaining tooth structure, causes it to crack. One day you bite down, half your tooth breaks off, and now you're in need of a crown. Sometimes a root canal included, and sometimes you actually split the tooth in half and you can't even save it. So I will always believe that silver fillings have caused more unnecessary dentistry than anything else, just for the fact that they break teeth. Well, the other aspect of that is when cold hits it. Since it's a metal product, again, if cold hits it, it contracts. It pulls away from the tooth, and now you have a gap between the silver filling and the tooth itself, and bacteria can get in that gap. I've been taking silver fillings out for 16 years now, and I was always shocked at how many of them had cavities underneath them. Well, they recently did a study out in Las Vegas where they removed 340 silver fillings, and under 67% of them they found cavities. That tells you right there that the product leaks and there's cavities underneath them. Left untreated, these are going to lead to root canals and other problems in the teeth. So I firmly believe that silver fillings are a product that shouldn't be used anymore. I believe there's no reason for a product that has mercury in it. I believe it breaks teeth and it leaks. We now have products, white porcelain products or composite products, that have none of those properties. They do not contain mercury. They do not expand or contract, so they do not break the tooth or leak. So from a longevity standpoint and the things that we can do to maintain our mouth, we look at three areas: the gums, the bite, and the teeth themselves. Again, if I can get you to brush twice a day, making sure that you floss and brush right before you go to bed is key to keeping healthy gums. Having all your teeth replaced, if you're missing any, leads to a stable, repeatable bite. You're going to be putting stresses on teeth the way that God intended for you to, and you won't have any problems. And last but not least, the teeth themselves. Silver fillings, I think, are obviously you want to get rid of all the cavities and everything else, but silver fillings are the one thing that I believe cause more broken teeth and more cavities than anything else. If you have those replaced to a composite material or a porcelain material, you will not have any more problems with those teeth. Again, my name is Edgar Luna. I want to thank Dr. Dave for giving me this opportunity to speak. If you'd like to know more about me, you can look at my website, www.diamondsmiles.com. Thank you very much.